Which tube should be collected first to prevent cross-contamination by additives? A. Light blue. B. Red, no additive. C. Yellow, SPS. D. Lavender. Answer: C. The yellow SPS tube is collected first to avoid contamination and preserve the integrity of blood cultures. What additive is found in the light blue top tube? A. EDTA. B. Sodium citrate. C. Heparin. D. Potassium oxalate. Answer: B. Light blue tubes contain sodium citrate, used for coagulation studies by binding calcium. Why is the red top tube drawn after the light blue tube? A. It has EDTA. B. It prevents clotting. C. It's additive-free. D. It contains preservatives. Answer: C. Red top tubes are additive-free or contain clot activators and are drawn after light blue to avoid dilution. Which tube is used for hematology tests like CBC? A. Green. B. Lavender. C. Gray. D. Light blue. Answer: B. Lavender top tubes contain EDTA, an anticoagulant essential for preserving blood cells in hematology. A green top tube contains what additive? A. Heparin. B. Sodium citrate. C. EDTA. D. Fluoride. Answer: A. Green top tubes contain heparin, which prevents clotting by inhibiting thrombin and is used for chemistry tests. What is the correct order of draw after using a butterfly needle and the first tube is light blue? A. Discard tube, then light blue. B. Red, then light blue. C. Lavender, then light blue. D. Gray, then red. Answer: A. A discard tube is used before light blue to ensure proper fill and accurate coagulation results. Which color tube should be used last in standard order of draw? A. Lavender. B. Light blue. C. Red. D. Gray. Answer: D. Gray tubes, used for glucose and alcohol tests, are drawn last because their additives can alter other test results. Which test requires a yellow SPS tube? A. Glucose tolerance. B. Blood culture. C. Lipid panel. D. CBC. Answer: B. Yellow SPS tubes are specifically used for blood cultures to detect bacteremia or septicemia. What is the additive in a gray top tube? A. Sodium citrate. B. EDTA. C. Sodium fluoride/potassium oxalate. D. Clot activator. Answer: C. Gray tubes contain sodium fluoride and potassium oxalate, which prevent glycolysis and preserve glucose. Why must EDTA tubes be drawn after serum tubes? A. To prevent cell clumping. B. To maintain pressure. C. To avoid anticoagulant interference. D. To enhance clotting. Answer: C. Drawing EDTA before serum tubes can contaminate samples and interfere with test results due to its strong anticoagulant properties. What is the main function of sodium citrate in light blue tubes? A. Preserves glucose. B. Binds calcium. C. Enhances clotting. D. Preserves platelets. Answer: B. Sodium citrate binds calcium to prevent clotting for accurate coagulation studies like PT and PTT. Which tube contains no anticoagulant and allows clot formation? A. Red. B. Lavender. C. Light blue. D. Gray. Answer: A. Red tubes may contain no additives or just a clot activator, allowing serum to separate for testing. Which test result would be compromised by drawing a lavender tube before a red one? A. Point. B. CBC. C. Electrolytes. D. Vitamin D. Answer, D. Contamination from EDTA in lavender tubes may falsely lower calcium and other serum analytes. Which of the following is collected using a green top tube? A. Glucose. B. Blood culture. C. Ammonia. D. ESR. Answer, C. Green tubes are used for plasma chemistry tests including ammonia, which requires rapid processing. Which color indicates a serum separator tube, SST? A. Red. B. Gold. C. Gray. D. Green. Answer, B. Gold SST tubes have a gel separator and clot activator for serum separation in chemistry panels. What additive is found in lavender tubes? A. Sodium fluoride. B. Sodium citrate. C. EDTA. D. Heparin. Answer, C. EDTA in lavender tubes prevents blood from clotting by binding calcium, used in hematology. What does the gel in an SST tube do during centrifugation? A. Promotes clotting. B. Inhibits bacteria. C. Separates serum from cells. D. Prevents hemolysis. Answer, C. The gel barrier rises between serum and blood cells during centrifugation, aiding in clean separation. What is the risk of reversing the order of draw? A. Incorrect labels. B. Needle damage. C. Additive carryover. D. Incomplete fill. Answer, C. Drawing tubes out of order risks additive contamination, affecting test accuracy. When collecting a PT and CBC, which tube comes first? A. Lavender. B. Green. C. Red. D. Light blue. Answer, D. Light blue is drawn before lavender to avoid EDTA contamination in coagulation tests. What is the correct order of draw for routine venipuncture? A. Red, green, lavender, gray. B. Yellow, light blue, red, green, lavender, gray. C. Lavender, gray, green. D. Gray, yellow, red, green. Answer, B. The CLSI recommended order starts with yellow, SPS, then light blue, red/SST, green, lavender, then gray. What does potassium oxalate do in gray tubes? A. Prevents hemolysis. B. Binds calcium to stop clotting. C. Kills bacteria. D. Clots the sample quickly. Answer, B. Potassium oxalate is an anticoagulant that binds calcium, preventing clotting in glucose tests. Why must tubes be filled completely and mixed gently? A. To avoid dilution. B. To activate clotting. C. To ensure additive efficiency. D. To eliminate bubbles. Answer, C. Proper fill and gentle inversion ensure the additive is evenly distributed without damaging cells. Which test is performed on a specimen from a gray tube? A. Point. B. Lipid panel. C. Blood glucose. D. CBC. Answer, C. Gray tubes are used for glucose testing because they contain preservatives that inhibit glycolysis. What problem arises if the green tube is drawn before the light blue tube? A. EDTA contamination. B. Coagulation test interference. C. Glucose breakdown. D. Clotting in tube. Answer, B. Heparin from green tubes can interfere with coagulation studies if drawn before light blue. Which tube is drawn immediately before lavender in the correct order? A. Red. B. Green. C. Light blue. D. Yellow. Answer, B. The green tube is drawn just before lavender in the standard order to prevent additive interference.